Okay, Borrelia species. So Borrelia is part of the Spirochetes, as we had said. We are done with syphilis, now we do Borrelia. So Borrelia, similar to Spirochetes, very poor when we do gram stain. This is under light microscopy, phase contrast microscopy. Can you appreciate the coiled shape and how long they are? So this is used when using James stain. And then Borrelia species. So we have three main types of Borrelia, but I want you to remember one main one. These ones are good to know. Let's start with Borrelia recurrentis. So how I remember Borrelia recurrentis is it causes recurrent or relapsing fever. Okay, transmitted by a louse. So take note, not a tick, a louse. Okay, you know lice, the ones that are found in hair. Then Borrelia species, other than that, it causes, this is the tick-borne relapsing fever. Okay, this is the tick. The reservoir in Borrelia are humans. And this one in Borrelia recurrentis are humans. In Borrelia species is the rodents. These are the mice and soft-shelled ticks. And then for Borrelia burgdorferi, which is the most important one, which causes Lyme disease, the reservoir are the rodents. Rodents are the main reservoir, but you can also have deer, domestic pets, hard-shelled ticks. Then it is transmitted by the Ixodes tick. Okay, so this is a good summary. Now, let's go to burgdorferi, which is the most important that causes Lyme disease. Gram-negative, but stain poorly and need to be visualized by other means. The other means are the dark field microscopy and serological testing. Long, slender, flexible, corkscrew-shaped rods, highly motile, difficult and time-consuming to culture, so we don't even culture. It causes Lyme disease. So you're going to ask yourself, what is Lyme disease? So Lyme disease, this is mostly an American thing. Lyme is actually a town in the US, usually found on the northeastern part of the US. So the northeastern part of the US are areas of Connecticut, Massachusetts. Okay, there's a town called Lyme disease. So what basically was happening is patients would go hiking, and then a few days later, they come back with this type of rash. And this rash is very, very specific. We call it the bullseye rash. Okay, bullseye rash. Can you see? It looks like a target sign. So it's round, and then there's some redness or erythematous spot in the middle. Okay, so it's called erythema chronicum migrans rash. So people just call it target rash or bullseye rash. Okay, or erythema migrans rash. This is for Lyme disease. Okay. Then you see for Lyme disease, similar to syphilis, presents with different stages. Okay, so there are three main stages. Remember for syphilis, there were three stages, similar to Lyme disease. Now, what is going to happen is you have to be bitten by a tick, by the way. Okay. So what should happen is this tick should bite you, and it should be attached to your skin for at least 48 hours so that it transmits the bacteria. Okay. So it bites you, you don't notice, you just sleep. Most of the time when people go hiking and they're sleeping in the woods, the tick is going to bite them. Then after a while, it goes to the first stage. So the first stage is the rash. It is localized. Okay. So appearance of this bullseye rash is the first stage. So here, apart from the rash, you're also going to have very vague symptoms, the flu-like symptoms. So you're going to feel headache, maybe malaise, basically flu-like symptoms, you know, congested nose, runny nose, things like that. Now, From weeks to months, let's say you ignore, it now goes to stage 2. Now stage 2, as I said, with the other one, it's also systemic. What is happening here? There is dissemination of the bacteria. There'll be joint involvement. So you're going to have arthritis and myalgia. Myalgia means muscle pain. Arthritis is inflammation of the joints. Okay. Neurological complications. So here, the most common neurological complication is the Bell's palsy. Don't know if you guys remember Bell's palsy. So Bell's palsy is where you're going to have facial droop of one side of the face. Okay. It's usually a lower motor neuron infection. Basically, the facial nerve has been affected, so you're going to have a droop. That is the neurologic complication. And then another thing you can have is an AV block. Basically, you're going to have severe manifestations. So arrhythmias, difficulty in breathing, awareness of your heartbeat. That is usually in the second stage. Then months to years, we have the third stage. Now here, the third stage is where now there's less dissemination of the disease. You're going to have chronic arthritis. Remember here, you just had inflammation and pain, but now it's going to be chronic. You won't be able to walk without complaining of pain. CNS disease. So it usually causes encephalopathy. Okay, so encephal, that means the brain, then pathy, a pathology in the brain. Okay, and then it can also cause peripheral neuropathy, where you're going to feel tingling, numbness, and a weird sensation on your hands and feet. Okay, that is stage 3. So there are different drugs we use for each and every stage. So first stage, after seeing this rash, we usually give doxycycline. Okay, stage 2, because now the infection has disseminated, we call this the early dissemination phase. This is the late dissemination phase. Here we give IV ceftriaxone. Okay, ceftriaxone is a cephalosporin, it's a stronger antibiotic. Okay, are we clear? So that is for the pathology of Borrelia. Now, as you can see here on dark microscopy, you see they're appearing white on a dark background, as I had said. Then the drugs we use, amoxicillin. So amoxicillin is mainly used for pregnant patients and for children less than 8 years old. We give them amoxicillin, but usually the first line is usually doxycycline. And then cefuroxime and ceftriaxone, this is usually when treating the second line. And then for Borrelia recurrentis and this other one, what is happening here, maybe just to mention, let's go back to these Borrelia species. We have something called relapsing fever. Okay. So what is happening in relapsing fever for these two? This is louse-borne recurrentis, and then this is tick-borne Borrelia species. We call it SPP or species. So here, the fevers are coming and going. Coming and going. You know, to relapse means to come. To relapse means to come back. So it was gone, then it came back. Okay. So what is happening here is the relapsing fever is caused by the different antigens that are found within the Borrelia species itself. So this specific antigen is going to cause a fever at that time. And then there'll be antigenic variation. You remember we talked about that. Then it causes fever another time, like that, like that. They're going to be having bouts of fever that are going and coming back, going and coming back, going and coming back. Okay, that's all you have to know about the relapsing fever. Okay, so for the relapsing fever, we do penicillin, doxycycline, erythromycin. So you can't give all these. So the first line, usually penicillin. For those allergic, we do erythromycin and then doxycycline. So you're going to notice on most of these, we usually call them zoonotic bacteria. Zoonotic bacteria means these are infections transmitted between animals and human beings. The drug of choice is usually doxycycline, which is a tetracycline. Okay, you see Borrelia is transmitted from a louse. These are the Borrelia from a tick. Another one is Rickettsia we're going to mention. There are quite a few. Yersinia from a mouse, like that. The drug of choice is doxycycline. So I want you to remember that. Are we clear? Then here is the clinical case definition. Erythema migrans greater than 5 centimeters in diameter, at least one late manifestation, musculoskeletal, CNS, or cardiovascular involvement, and lab confirmation of infection. Then lab criteria, isolation of Borrelia burgdorferi, demonstration of diagnostic levels of IgM and IgG. Remember, IgM is indicative of acute infection. IgG is a chronic infection. Significant increase in antibody titers between acute and convalescent serum samples. PCR is used to assist in the detection of burgdorferi in body fluids, provides most definitive test. With serological tests, number of false positive can outnumber the true positive. So that's why we have to do dark field microscopy to visualize the spirochetes. Okay. I hope we're clear there. Any question on Borrelia species? None. Okay. Let's go to Leptospira. So this is the last of the 3 spirochetes. Leptospira, not a lot to know, but I'll tell you the high-level things you should know about Leptospira. So it's responsible for Weil's disease. I'm going to explain what that is. And that is the most severe form of leptospirosis. So it causes a disease known as leptospirosis. Now, remember, gram-negative but poorly stained, long, very slender, flexible, spiral or corkscrew-shaped rods, highly motile, cultured on specialized media, EMJH, though this is very low yield, but that's just good to know. Then on Sievers stain, you can appreciate the corkscrew appearance of this bacteria. Then, now I want to explain Leptospira. Now, for Leptospira, what I want you to know is, number 1, how do we get leptospirosis? Okay. How do we get leptospirosis? So the classic scenario is someone has gone to the beach or something like that, or yeah, to the beach, let's say to the beach, and they are going to develop some flu-like illnesses. Okay. Then after flu-like illness, they are going to develop red eyes, as you can see here, scleral hemorrhages in a jaundiced patient. I'm going to explain. And then after that, so they're going to get these red eyes and jaundice. So when you see that in an exam, you'll know that this is Leptospira. So you're going to ask yourself, what is happening here? So this spirochete is usually found in water. So that's why I used beach as an example. Okay. And this water, for it to have the Leptospira, it has to be contaminated by animal urine. Okay. So this animal urine is the one that is going to pass. The main reservoir are the mice and the rats. They are going to shed the Leptospira in urine. Then this urine is going to contaminate water. So once you get in contact with this water is when you're going to present with these Leptospira findings. So at first, you're going to have flu-like illnesses, flu-like symptoms. Then after that, you're going to have muscle pain. Okay, so here is the marsh fever. Then you're going to have some muscle pain. Then as it progresses, you're going to have jaundice. So jaundice is the yellowness of the eyes. Okay, normally it's yellowness of the eyes and the palms. That is what we call as jaundice or ichthus. Then after that, it's going to go to CNS infection. So you're going to have some photophobia, which is the fear of light. And then we call it conjunctival suffusion, or basically the red eyes. So remember, you're having jaundice and you're having the suffusion or the red eyes. So we usually call it scleral hemorrhage. Okay, scleral hemorrhage in a jaundice patient. So basically red eyes, red, as you can see here, they are red, but there's in a yellow background. Okay. So this is very specific for leptospirosis. Then Weil disease. So Weil disease is when you're having now a severe form of this, because if you don't treat, it is going to continue disseminating. Once it disseminates, you have the red eyes and the jaundice. We call it ectohemorrhagic leptospirosis. Ectro, so that is jaundice, hemorrhagic, red eyes with jaundice. And then you're going to have other organ involvement, especially the liver and the kidney. So for liver involvement, you're going to have the jaundice due to the liver involvement, and then kidney dysfunction due to the bacteria itself. So how is it going to present? You're going to have lab findings of increased urea, deranged electrolytes, increased level of creatinine in blood. Okay. So the most important thing I want you to remember here is the flu-like symptoms, myalgia, and the ectohemorrhagic leptospirosis. Okay, then Weil disease is now when there's liver involvement, kidney involvement. Okay, any question? So there's a term here they have used, Swinehart's disease. So Swinehart's disease is the disease they used to call it before. They used to call it leptospirosis. Okay, so it was mainly seen in swineherds. So for people who used to keep pigs. Okay. Usually it presents with meningitis following the keeping of pigs. So that is Swinehart's disease. So that is caused by Leptospira interrogans. Are we clear? Then these are the diagnostic tests for leptospirosis. Gram stain, too thin to detect. Dark field examination, insensitive and non-specific. Silver stain, insensitive, non-specific. Direct fluorescent antibody, insensitive and specific, sorry. In blood, positive during first 10 days. CSF, positive first 10 days. Urine, positive after first week. Then direct hybridization, insensitive but specific. Amplification, now this is PCR we use. It's very sensitive and specific. Serology, and then microscopic agglutination test. Okay, this is for the test accuracy. Okay, you see when you do the direct fluorescent antibody, you're just going to see the spirochetes, but you won't know what is it specific for. Is it Borrelia? Is it Treponema, or is it leptospirosis? So you have to have, that's why you take a very good medical history to see. So it's going to confirm to you, okay, there is spirochetes, but from the medical history, you're going to know that this is a person who had contact with contaminated water and is presenting with the ectohemorrhagic leptospirosis. So you'll know it's leptospira. And then this is a review of the spirochetes. Here they are. And summary of Treponema. Here they are. Summary of Borrelia. Here it is. And then summary of Leptospira. You can see here, people are infected with Leptospira through exposure of water contaminated with urine from an infected animal or handling of tissues from an infected animal. So anywhere you're exposed to these urine contaminated streams, rivers, standing water, that is an occupational hazard. Okay. Thank you. Any questions?